welcome back to New Day Cleveland. Our next guest is here to take some of the pain out of dental work. Dr. Laurel Gans is here from Euclid Dental.
Thanks for having me.
And people always make jokes about pulling teeth. Mm-hmm. You pull teeth for a living.
I do.
Why do people need their teeth pulled?
There's a few reasons. Wisdom teeth, there's not always room for them, so those need to come out. Sometimes teeth become infected or they break, and those also need to come out. Sometimes it's orthodontic reasons. Kids don't have enough room in their mouth for all their teeth, so sometimes they'll extract teeth to make room for all the other teeth.
Now, somebody told me sometimes people get nervous about having their teeth pulled, and then most dentists say, you don't have to be nervous, but I just learned you're gonna have some teeth pulled.
I am.
And you're a little nervous.
I am a little nervous.
I guess it's a natural thing then, right?
Yeah. I mean, I think anytime anyone's working on you and you can't see what they're doing, it's normal to get nervous. But there's a lot of ways to make patients more comfortable. When you're numb, all you're gonna feel is pressure. So a lot of people, once I've done it, they're like, oh, it's done already?
Yeah.
Like it's kind of anticlimactic. So,
do they do, so they still, do they do the thing they put like Novocaine or something or some kind of drug in your mouth to numb your mouth?
Yeah, we put some jelly on first, some topical medication so that you don't actually feel the shot. And then we'll give you medicine. It's actually lidocaine. Sometimes I'll give you something a little stronger. It's called septicaine. It just depends on your medical history and how quickly you numb. And then you just feel pressure, really.
How long does it take to get I usually just tie a string on the door to slam
That's
the door.
what I do at home.
Yeah, right, that's what we should be doing. But how long is it, like you go in for this, how long does it take and how long is the recovery for people?
It varies so much. You know, sometimes a tooth will come right out, and then sometimes a tooth that looks like it'll be the same amount of challenge or not challenge on x-ray will take a long time. So it varies so much. And then some people are up and about that day. I had one patient who was like, I'm going to work today. And went right to work and he was fine.
What's that thing called, like when they take the nerve out of your tooth? And
a root canal.
A root canal. So does that make it harder to pull a tooth then?
It does generally. Once you have a root canal, a tooth becomes very brittle. So oftentimes when you're taking it out, it'll break into multiple pieces. So they're a little bit more of a challenge.
So when a tooth comes out, sometimes you have to take a tooth out in multiple pieces anyway, right? Yeah,
sometimes it's easier to, like if you have a tooth with two roots, it's easier to split it in half, and then it's like taking out two teeth with one root.
Oh, so that makes it a lot easier on the person.
Yep.
Yeah, so is it a different procedure like for little kids versus like older patients or elderly?
Yeah, for little kids, oftentimes it's a baby tooth, and so those will come right out. A lot of times they don't have roots on them, so they're like nothing. Kids don't even know I did anything. When they're older, it's a little bit harder. The teeth are more brittle, the bone is more solid, so it's a bigger procedure, but still manageable.
This is a little off the subject, but how about if somebody gets their tooth knocked out? What do they do? Like they accidentally pulled their own tooth.
Oh, it's not a great situation to be in.
I could figure that.
I mean, the most important thing to do is to, if you can, put it right back up in there. Oftentimes, if you can't get it back up in there, you want to protect the tooth. There's a lot of theories about milk, but actually your own spit is the best thing for it. So just kind of keep it protected with some of your spit and
that's crazy.
Get to the dentist.
Yeah. And how about when do you know you might have to have teeth pulled? Like you mentioned, like you have to have your wisdom teeth taken out. I mean, is there something that alerts you to that? I mean, how do you know?
Oftentimes you'll feel like pain or pressure. It depends on the reason. So if there's not enough room or if something's starting to get infected, you'll feel pain. If it's a nerve issue or the tooth's infected, people will know. They will come in saying they're in pain, or sometimes they even get swollen. So your body will give you the signs.
Euclid Dental. I tell you what, you're a lot prettier and a lot nicer than any of my dentists ever were.
Thank you.
You're lovely, but don't pull my teeth. Hey, hey, coming up tomorrow, folks, it's Christmas in Hartville. We're going to make the trip down to Stark County to visit some of our favorite places. So that's going to be a real good one. Happy holidays, everyone. Merry Christmas. Have a great New Year.